moderator today. She's a community news publisher in Interior, British Columbia. And she's also a current student in our Masters of Professional Communications program. And her research is focusing on new journalism models and practices. So I'll turn it over to Brandy. Thank you both for running this event or running this session this morning. And I look forward to hearing the conversation. Thank you.
Wonderful. Thank you so much for that introduction, Chase. I'm very excited to be here to help start day 2 of the conference. I'm really looking forward to hearing more about this morning's topic, which is ethical challenges and responses to COVID-19 with Susan Gilbert. I'd like to begin by acknowledging that Royal Roads is located on the traditional lands of the Esquimalt and Songhees ancestors and families who have lived there for thousands of years. And I acknowledge the rich history of this land. I'm joining you from Sun Peaks, British Columbia, which is located on the traditional and unceded territories of the Secwepemc peoples. This high alpine area is an important traditional hunting and gathering ground, and I'm grateful to be able to continue learning about this remarkable land and what it means to the Secwepemc peoples. If you would like to, feel free to drop into the chat whose lands you are joining us from today. I know that we are welcoming people from all over British Columbia and other Indigenous lands. Awesome, thank you. So do feel free to use that chat function throughout this morning's talk, as we are going to be collecting questions for Susan to address at the end of the presentation. And please do just keep in mind that we are creating a safe space this morning for respectful and constructive discussion. As another housekeeping item, just for best viewing purposes, make sure that you have selected speaker view, which is in the upper right top corner of your screen, which will give you the best view for today's talk. And just as an FYI, today's session will also be recorded. So as I mentioned, this morning's discussion will center around ethical challenges and responses to COVID-19, which is something that we can all relate to as we have been living and learning these ethical challenges and considerations in both our professional and private lives throughout the past year. And that's why I'm incredibly honored to welcome Susan Gilbert, who is the Director of Communications for the Hastings Center based in Garrison, New York. The Hastings Center is a nonprofit, nonpartisan bioethics research organization created from multiple disciplines, including philosophy, law, political science, and education, and is the oldest research institute of its kind in the world. As the editor of the Hastings Bioethics Forum, Susan Gilbert has been at the forefront of international communications from the beginning of the COVID-19 pandemic, and was publishing ethical questions regarding communication around COVID-19 in China as early as January 2020. So throughout the global pandemic, Susan and her colleagues at the Hastings Center have been leading important conversations debating the ethical issues raised by COVID-19 in the US and around the world. And before coming to the Hastings Center, Susan was a contributor to the New York Times. So thank you again for being here, Susan. And with that, I will turn it over to you.
Thank you, Brandy. That was a great introduction, and I'm thrilled to be here. I'm also having difficulty uploading my slides. So let me just try again.
I have them too, Susan, so I can upload them if you.
Oh, that would be great, because I'm not yeah, I'm not seeing an option for getting them up. So that would be just terrific if you could do that.
You betcha.
No worries. Everybody can just hang tight for a quick moment while we navigate a fun technical Zoom glitch.
Okay.
What is the range of places where everybody's from? I'm thrilled that there's such a big audience.
Yeah, I'm seeing a lot of people here from Merritt, British Columbia, Silex territory, Algonquin Anishinaabe Nation, acknowledging the traditional territory of the Kutana people, home to the Kinbasket people, Dene, Cree, and Métis territory. So wonderful. Yeah, a very wide geographic area here.
Amara, can you make me co-host, please? I put you as host because once I screen share, I won't be able to do anything else, but I'm not able to screen share without that privilege.
I know yesterday, Susan, we had people from all across Canada and a few people internationally. So I would expect that we have the same here from all the way from the East Coast of Canada to out here in the West and some from Mexico and different places. So
That's fantastic. Really exciting. And will the sessions be recorded for later viewing?
Yes, they will be recorded.
That's great.
Yeah.
Okay, thank you for uploading my slides. And do I have the option of advancing them or?
I think I need to, but
Oh,
you just say,
sorry about
move
that.
along and I'll be here for you.
Okay, sure. So I'm Susan Gilbert. I'm the Communications Director of the Hastings Center. The Hastings Center is a bioethics research institute based in Garrison, New York, which is about an hour and a half north of New York City. So a little bit slower, slower pace than the reputed fast pace of New York City. But of course, now we're all working virtually because of the pandemic. So I'm actually closer to the city at this point. Would you mind advancing the slides? So the Hastings Center is the world's longest serving independent bioethics research institute. Next slide. It was founded in 1969, and its mission is to address social and ethical issues in healthcare, science, and technology. The Hastings Center conducts original research in a wide range of areas, and I'm giving you some here and on the next slide. Everything from ethical issues to do with aging, and that would be decision-making at the end of life, but also kind of a broader suite of ethical issues that, at least in the United States, are facing people as they age. The United States and perhaps Canada, I'm not sure, is considered an aging society. And that has come with a suite of ethical issues just that are very bound up in economics and in conditions such as dementia. So we're looking at some of those. We also have several projects to do with genetics, genomics research, and gene editing. In addition to research, we are committed to public engagement. Next slide. And that is what I'm going to focus on today. So the Hastings Center has always been public facing. And what I mean by that is it has always been focused on communicating with journalists, policymakers, and the general public, because bioethics issues are vital to communities and individuals. I think of them as the kinds of issues that people talk about around the kitchen table or even at parties when we used to have parties. Hopefully we will again. And as I went on the Royal Roads website, it occurred to me that the aims of the Hastings Center are in sync with the mission of Royal Roads, producing citizens of the world who are passionate, determined, and confident lifelong learners. And so we aim to help with that in communicating trustworthy information, accurate information about important, vital societal issues. So bioethics rose as a field, rose in tandem with the news, reporting by journalists about ethical dilemmas raised by advances in medicine. And here's a prominent example. Back in 1962, November 1962, Life magazine, which was a very big publication, widely read publication of the day, ran an article that got a lot of attention and is still talked about today. And this was about the so-called God Committee of a hospital in Seattle that was tasked with deciding literally who lives and who dies. There was a new medical technology called dialysis. And this hospital in Seattle had one dialysis machine. And the machine was life-saving to people with kidney disease, but given that there was just one machine, not everybody who might be able to benefit from going on dialysis could have access to it. There was a recognition that making the decision who lives and who dies should not be made at the bedside by individual clinicians, that was just a terrible burden to put on clinicians. And so a committee of lawyers, clergymen, bankers, sort of people at large was assembled to wrestle with questions of like literally who lives and who dies, who deserves to get dialysis and who does not. So fair allocation of resources is a bioethics issue, and it has been a big issue in response to the COVID pandemic and the Hastings Center's communications about ethical issues raised by the pandemic. And here are a few examples. Who should be prioritized to receive scarce COVID vaccines? And how should this be done fairly? Of the patients who become severely ill, who should get a ventilator if a hospital, who should get on ventilators if a hospital doesn't have enough for everybody in need? Should age be a factor in determining who gets priority for COVID testing and treatment? And if you wouldn't mind advancing the slide again. So now I'm going to go back to when the Hastings Center began communicating about ethical issues raised by COVID-19. It was January of 2020. The mysterious deadly infection circulating in Wuhan, China didn't yet have a name. There were science questions. What is this virus? Could it be transmitted from person to person in addition to what was known back then, which is that it could be transmitted from animals to humans? But no one was talking or writing about ethical questions. Then one day I received an email from a bioethicist in China, a Hastings Center fellow. Hastings Center fellows are scholars and others around the world who've distinguished themselves in research on bioethics related issues. And so this fellow was one of those. He and a colleague who's also a Hastings Center fellow were submitting a post to our blog, Hastings Bioethics Forum, which I edit. Their post was on ethical questions about China's response to the virus. If you wouldn't mind advancing the slide. So they cited a lack of transparency from the government, including a misleading message to the public that the epidemic was not a serious problem. Next slide, please. They went on, the omission of updates on the epidemic and faked misleading information shifted the public's attention from the epidemic and inhibited the efforts by medical and public health staff to control it. This was a case in which public health intervention was devastatingly compromised by politics. Wow, this post was remarkable for its boldness and criticism. It raised ethical questions about China's response to the virus, but it also raised ethical questions for me, communications ethics questions. I wondered, could posting this essay get the authors in trouble? One of the authors, Ruping Lei, is based in Wuhan. Was it ethical to post this? So I talked with my colleagues, and we agreed that the authors wanted it posted. They knew as well as anyone what risks they might be taking. The post certainly provided new information and insight to our audience, which is largely a Western audience, and so we posted it. Then they followed up a month later. So this was posted on January 31st, and a couple of weeks later, on February 11th, they followed with another post, and that's on the next slide. And this one was about the death of Dr. Li Wenlang, the whistleblower physician who was punished by the government for giving unauthorized information about the virus to colleagues. They wrote, his death sparked anguish and anger because it underscored gaps and deficiencies in our country's healthcare system and system of governance. As bioethicists, we think that it is a good time for our country to reflect on those deficiencies and consider reforms. Oops, maybe go back one. So after these posts, Hastings Bioethics Forum was dominated by posts about ethical issues raised by the pandemic. These posts came from the United States, from Canada, from Qatar, New Zealand, the UK. Reading them now, a year later, is like reading the first draft of the history of COVID-19. The ethical issues evolved in response to scientific understanding about the virus, policies to control it, experimental treatments, and clinical trials for vaccines. This topic got a lot of attention in our blog and elsewhere, confronting disability discrimination during the pandemic. If you wouldn't mind going to the next slide, you can elaborate on what that is. So people with chronic conditions and disabilities are particularly vulnerable to COVID, but they have faced longstanding barriers and inequities in healthcare. There were court cases, or there were legal charges, I don't know if they actually went to court in the United States, charging certain hospital systems with discrimination against disabled patients, charging that their protocol to determine who gets put on a ventilator discriminated against people with disabilities. And what they were based on is these protocols often use as a factor in determining who gets a ventilator and who doesn't, survivability. And that criterion works against people with disabilities. And so here, these authors who are scholars and disabilities advocates for disability rights, said the challenge is to develop triage protocols that will minimize rather than magnify structural discrimination in the healthcare system. So in addition to surfacing longstanding discrimination against disabled patients, COVID has amplified longstanding systemic racism. Black and Latinx communities in the US and elsewhere have been at greater risk of infection and death from COVID. Black Lives Matter protests occurred throughout the US and the world last summer. These protests underscored ethical problems of racism throughout society, but they also posed a particular ethical dilemma that related to COVID. Next slide, please. So the protests themselves interfered with social distancing protocols. Was that justified? If so, why were Black Lives Matter protests considered okay as an ethical by healthcare professionals and those concerned with public health, when other protests raging across the United States and elsewhere last summer, the anti-lockdown protests, were condemned by health professionals? So this Bioethics Forum post addressed that question. The authors were a group of doctors who argued that the purpose of the anti-lockdown protest is diametrically opposed to medical recommendations, while the Black Lives Matter protest demands were consistent with public health imperatives. And so considering the trade-off, they felt that the Black Lives Matter protests were justified from a public health point of view. Ethical issues raised by COVID came from many perspectives. And on the next slide, you'll see a post by a Hindu bioethicist in the United States who wrote about why he decided to volunteer for the Moderna vaccine trial, that he saw this as a demonstration of his Hindu obligations to give or donate for the greater good. But he experienced a dilemma because he worried that the vaccine, should it come on the market, which it now has, whether it would be affordable, much less available to impoverished countries and to individuals who are poor within wealthier countries. So he worried that he was doing something that went against his values and that he was really just fostering drug company profits. We also had posts from Islamic perspectives, including concerns about harm from COVID vaccines that had gotten into the news lately. Some of our posts came to media, led to media coverage, and I'll show you on the next slide. So we had a post by a bioethicist named Larry Churchill called "Being an Elder in a Pandemic." in which he discussed why he, as a person in his 70s, thinks that older people should let younger people have priority in testing and treatment for COVID. And his reason was, I've lived a full life. Younger people have their lives ahead of them and should have a shot. So this post came to the attention of a journalist at the New York Times who writes a column called The New Old Age. She ended up interviewing Larry Churchill about his views and wrote a column that balanced his views with the other, the sort of opposite view, in a sense, that older people may end up being discriminated against. In other words, arbitrarily sent to the end of the line should medical rationing become necessary. Next slide, please. So beginning last spring, so not long after the world was locking down, getting locked down from COVID, the Hastings Center did other work on ethical issues raised by COVID-19. And this was kind of a convergence of our research and our public engagement. So one of our scholars directed the production of a series of ethics guidance documents that were geared to healthcare institutions in the United States for them to refer to when confronted with ethical dilemmas, such as allocating ventilators during emergency, during crisis conditions, and assuring access to palliative care drugs should they become scarce. And these documents were posted on our website and made available for free. They were used by hospitals and other healthcare institutions in the US, and journalists wrote about them and the ethical issues they addressed. And if you go to the next slide, you can see this is a little screenshot of a little piece of our COVID ethics hub and two examples of these COVID ethics resources, which we continue to put out. The most recent one came out last month, and it had to do with vaccine allocation. So as the year progressed, the Hastings Center wanted to explore other means of communication with the public about ethical issues raised by COVID. After all, the pandemic dominated the news. It dominated the lives of people around the world. We all had questions. We all wanted desperately to get back to normal, whatever that means. Businesses were suffering, many were folding. How do we balance personal responsibility with public health? How do we balance public health with economic health? Were they mutually exclusive? And so we did something we hadn't done before. We launched a webinar series, and you can see that on the next slide. So we launched a webinar series called Reopening the Nation, What Values Should Guide Us? And the first one featured Zeke Emanuel, who many of you may know has been a prominent writer. He had a position in the Obama administration, and he was on the Biden transition team advising on COVID policy. So this was the first of several webinars that we did last year. They attracted over 1,000 people each. They're also archived on our website for later viewing. And the way these were structured is our president, Mildred Solomon, who you see on the far right, would kind of have a discussion with some experts in a particular area. And other webinars followed, which you can see on the next slide. We looked at privacy, surveillance, and digital tools for contact tracing. And then the question of, should we turn to immunity testing, which has become kind of an issue now. I mean, now that people are getting vaccinated, and the travel industry, airlines and so forth, are hoping to get more passengers. There's discussion, and I think that there are companies working on this to develop systems where people can prove that they've been vaccinated. And that itself raises a host of ethical questions. Can the system be gamed? There are privacy concerns. There are concerns about who has access to that sort of, assurance and the advantages that would accrue to somebody who's able to prove that they're immune, if in fact immunity testing can do that. On the next slide, you'll see what was perhaps our biggest webinar, and this occurred in November, and it looked at public trust in science, and it featured Dr. Anthony Fauci. You might wonder, what does public trust in science have to do with bioethics? A lot. Good ethics begins with solid facts. And there's been a lot of misinformation on COVID and mistrust of scientific experts, perhaps particularly in the United States. So you can't fight the pandemic, much less address ethical questions, without first gathering trustworthy information. And so that's what this webinar focused on, and it attracted, over 1,000 viewers, which we were thrilled about. So on the next slide, you'll see our work on COVID continues. This is just a smattering of some of the recent articles in which our experts, our research scholars have been quoted. The one on the top, and now that vaccine access is sort of the big news, that's what everybody wants to talk to our scholars about. So, I don't know how the vaccine rollout has been going in Canada, but in the US, it's been pretty rocky. And so people are doing what they do and trying to game the system and crossing state borders. Is that ethical? No. There's also, at the other end of the spectrum, there's vaccine hesitancy and people who are afraid to get a vaccine, in particular people in certain groups, communities that are distrustful of the healthcare system to begin with, or who feel that the way the vaccine is being rolled out in their communities doesn't even take their community's values into account. There are a few other headlines on the next slide. So race has been a big issue, again, perhaps particularly in the United States, with the vaccine rollout, with white, middle class, and affluent people being vaccinated at much higher rates than Black people, Latinx, people in rural communities, people in poor communities who are getting elbowed out by people who are savvier, have more time on their hands, and sort of manage to maneuver their place to the head of the line. So that's obviously not fair. I invite you to visit our website, which the URL is on the next slide, to visit the blog, to read the blog, Bioethics Forum, and to check us out on Twitter at Hastings Center, and to stay in touch with me. This is my email and my Twitter handle as well. So I invite you to ask questions.
Wow, Susan, that was really great. You touched on so many little ethical explosions just in the short little time period that we had there. So thank you so much. I just had a question to start us off with. Would you say that there is a nation or potentially a place that has dealt with these ethical issues in potentially a better, or like a way that could be an example for the rest of us that are trying to navigate these things?
I don't know. I mean, I wish I had one of our research scholars sort of here with me to ask her. That Nancy Berlinger, who has led our COVID work, might have an opinion about that. I think that every country has had its issues. So I don't have an answer. I mean, some have done better than others. This will be debated probably for years, whether democracies do better or worse than countries that are more autocratic. Every place has had its issues. China certainly stumbled in the beginning, but then it got things under control. It had some recurrences of COVID, but that has raised the question of whether a country's ability to really impose orders on the entire population might be more effective than a sort of
Right.
You figure it out. I mean, the United States, I don't want to get too political here, but I mean, we had a void in leadership. States were kind of left to figure it out on their own. we had a president who was, promoting a mistrust in science, criticizing, his own scientific advisors, censoring scientific information from the Centers for Disease Control. So that's not going a long way to promote positive response to a pandemic.
Definitely. We had someone referring to a New York Times article that came out today talking about how we're treating and respecting our healthcare workers throughout the pandemic, and how can we do that in a more ethical way. Do you have any thoughts on that?
I wish I had seen that article. I didn't. I know, I guess I would ask, who is the we here? Would this be healthcare workers feel that their institutions aren't supporting them? Certainly, again, in the United States, I mean, some healthcare institutions are wealthier than others, and there were incidents of, well-to-do institutions like, Columbia University Medical Center, Mount Sinai in Manhattan, that are very wealthy and had where the clinicians had plenty of PPE, and others that were in, poor communities that were just, they didn't have enough. They were just stretched to the limit. They didn't have enough protective equipment. So that's clearly, not fair. There was a lot of burnout. In a perfect world, everybody on the front lines would be adequately protected. I think we've gotten better at that, but perhaps aren't there yet.
Yes, thinking back to the beginning of the pandemic, there was a lot of vocal support for our healthcare workers. We were out banging pots, at 7 p.m. and that has just really waned as everything has gone on. So it's an interesting topic. You touched a little bit on vaccines and a little bit about developing nations, and just looking forward, how do you think that we can ethically navigate those developing nations receiving the vaccine in a timely manner? It's such a huge challenge.
Yeah, I mean, there too, I'm a little bit out of my depth here. I just know that it's been an issue. I mean, this was predicted a year ago, was that the wealthy nations would be getting right in there, before there were any vaccines, when they were just under development. The wealthy nations would get in there and they would buy up millions of doses, and poor countries would not be able to do that, and they need the help of the wealthier nations. And I mean, I'm pleased to see that the Biden administration has committed to helping in that effort. There was a group in Europe whose name I don't remember, but that was working through last year on ways to assure that medications and eventual vaccines got to poor and middle income countries.
I've heard also that it can be dangerous as well if we don't if we don't vaccinate these other developing nations as well, because the virus will continue to evolve in those places and eventually could come back around to vaccinated nations again. So there's a two-pronged issue there for sure.
Right. If you want to be selfish about it, it's in our own best interest to vaccinate everybody.
Yes, that's exactly what I was trying to say there too. We have a comment here. You said that crossing borders to become vaccinated was unethical. She was just wondering if you can expand on this comment a little bit. We do have Canadian snowbirds, people who winter down in the warmer states, who are getting vaccinations in some of their winter residence. Could you expand just on that topic a little bit?
Well, that may be kind of a different story because they're living in another place. What I was referring to was reports we were hearing about. I mean, that people, people are spending a lot of time on their computers if they've got the time and the internet connection and the savvy to really find out, where can I get a vaccine? There's nothing near me, but what about in the next state? And where that becomes unfair is you've got people who have the time, who have the know-how. So they've got, that equals they've got some privilege, they've got money, or at least enough that they can, not have to be working all the time. They've got an internet connection, they've got a home, and they are navigating a system. And if they are crossing a border, a state, a city, to get a vaccine, they are probably taking that vaccine away from somebody else, and possibly somebody in greater need. One example, it came also in the United States. So one of our scholars was interviewed by St. Louis Public Radio in Missouri, where apparently the city of St. Louis has like very poor vaccine availability. And so what people have been doing is traveling to rural areas of Missouri, in some cases like many, many hours. And so they're getting vaccinated there, and that's really good for them. But the population of rural Missouri in the outlying areas of St. Louis is very poor, very old, and has chronic conditions. So these are people who like really need to be vaccinated.
We had a highly publicized case here in British Columbia where a wealthy couple took a plane to a remote Indigenous community up in north and posed as motel employees to get a vaccine that was not allocated for them, and it was exactly that type of situation. So yeah, I can see the two extremes there for sure. We have one here regarding distribution of the vaccine. Sorry. Do you think that governments will continue to use economic equations to justify action or inaction when we consider the lives and trillions of dollars lost for the poorest people versus the amount of money it will take to redistribute, or the amount of money that's being redistributed through the billionaire class?
I wish I knew the answer to that question, but I don't know. I would just hope that people would, and nations would have a more of a sense of solidarity, and kind of getting back to what we were talking about earlier, that we are all in this together, even though in many senses we're not. Some people are in a better place than others, but that this is a global pandemic. And if ever there was a time for more privileged, wealthier nations to help out those less privileged and poorer, now is the time.
Wonderful. Is there anything else that you would like to add just as we wrap everything up, Susan?
Sure. Here's an ethical. Well, first of all, I guess I would ask if anybody has any thoughts about how, what are how to communicate about ethical issues raised by the pandemic smartly. Is there something that I missed that you'd like to add, or is there any, or would you like to comment on anything that I raised?
We do have a question here from Holly A. What would be some key advice about communicating around ethical issues, and what are the key challenges and techniques?
Well, obviously the first the first thing comes back to the good information and facts. So, in order to comment on the ethical issues, you have to be completely up on what's going on, and that's very demanding. We have been responding to the press all along, since COVID, emerged, and we continue to do it. But to do that really takes, kind of, in a way, never being off the clock. You have to be up on the latest news in order to respond intelligently. And since the press comes to us, to the Hastings Center, for questions that have to do with ethical issues, you don't know what the ethical issues are unless you know what the new developments are. So, if there's been an issue of gaming the system, like we were talking about before, the wealthy couple that, posed as hotel employees, or something I saw on Twitter the other day about I mean, this is like just too fun. It's funny, but you know, and they got caught, but two relatively young people, women, like somebody, you know, they were like in their 30s and they were in Florida and they thought they could get away with pretending to be over 65. I'm like, you know, I mean, of course they got busted, but like, why do people do that? You know, so it helps to sort of know stuff like that, because that's the kind of thing that makes the news. And so when a reporter calls, you don't want to say, oh, I think I have to play catch up. You have to sort of know. And that always being on your toes is pretty demanding. But it also fits with our mission of being public facing, of helping laymen, members of the general public, sort of make sense of complex developments.
Just related to kind of that always being on, has the rise of social media use by organizations and media and the public, how has that influenced how you manage ethical issues and ethical communication?
Well, that's a good question. You know, we use social media. I mean, we definitely use it more than we did just a few years ago. You know, I would say a primary reason why we are able to attract a large audience for our webinars is that we advertise them heavily on social media. That said, you know, I mean, social media presents its own ethical issues. So we're not, you know, we're not separating ourselves from it. And it's also how you know, you find out stuff on Twitter. Journalists find out about what we're doing on primarily Twitter.
It's all connected, isn't it?
Right.
So I think that is all of the questions that I see there in the chat. But I do want to again just thank you so much for taking this time to share with us a little bit of the amazing experience and knowledge that you've gained over this past year and throughout your career. And with that, I will turn it over to Chase.
Thank you very much, Brandy. It's been a pleasure.
Thanks, Susan.
Thanks, Susan and Brandy. Really interesting session, and I'm sure there's so many different things that is going to evolve as this issue and this pandemic keeps rolling forward, that maybe we might have to have a follow-up with you down the road, because there's things we can't even anticipate that are going to show up.
Please do. You know where to reach me.
Yeah, sounds great. And thank you so much for taking time out of your busy day to come and speak to us. We had a great turnout. I don't know if you saw the numbers, but we got up over 100 people. So
awesome.
That's a lot of people that we've reached and sent some good information to. So thank you again for coming, and stay safe, and hope that your family and everyone around you can weather this storm and we can get back to normal soon.
Thank you. Same to you. It's been a pleasure, and good luck with the rest of the conference.
Thanks so much.
Thanks, Susan.
Bye-bye.
Bye now. So we do have a next session is at 11 o'clock for anyone who's wanting to see that session. That session is going to be a panel discussion with Dr. Steenkamp, Alessandra Vinhez, Dr. Athena Madden, and Julie Holloway and Olalo Adeleye. So please tune into that. Perfect time for a coffee, and we'll leave the room open here with some soothing music. I think that's the plan. So you're welcome just to stay logged in, and we'll fire back up again in probably about a half an hour.